Hi, Dr. David here. So I want to talk about. Uh, I'm a student of military history. I'm a military veteran. You probably heard me say that a couple of times. But there are George S. Patton of World War II fame is one of my heroes. Yeah, but he had he was pretty rough around the edges in many regards, but he did get he won. He had tremendous victories. He won battles, and he knew how to motivate men and get them to fight and do things that they otherwise would not do. And he had three cardinal rules for battle, or the three cardinal rules of war, whatever you call them. One was speed, the second was simplicity, and the third was boldness. And you can understand that he had to make it. People had to act quickly and with decision to throw the enemy off guard and really attack and get things done with the least amount of casualty. Number two, they had to be simple. The orders had to be easily passed down from superior to the ones below them, and they had to be able to carry out these orders effectively. And number three, boldness. Yes, so it's war. Sometimes there might be hesitancy because the conditions may not be fair enough. And he was always like, let's get it done, let's get it done. Napoleon, by the way, Napoleon Bonaparte, he was like that as well. Anyway, I carry those same principles, well, two out of the three into our treatment when it comes to kids with brain disorders. So we have speed, simplicity, and the last one I'll say in a minute. Let's start with the first one, speed. The supplements, the people had to see, or the parents had to see results quickly, not in 1 month, not in 2 months, not in 3 months. They had to be able to see within that week so that they could come back within 2 weeks for a follow-up. They were spending a lot of, I mean, these were, you gotta tell, these were people from very low income areas. They hardly had the money even for transportation. And because we wanted them to come back to see how it was working, we always insisted, we knew we had to make sure that they could see results quickly. Number two, obviously, it had to be simple. Anything more than take one or two pills 3 times a day, or three pills 3 times a day, nothing more than that. Can't tell them some elaborate sequence of activities to do for their child. Remember, these are people from very poor neighborhoods. They had other kids to worry about. They had to make money that day, otherwise they would not eat. So we had to make it as simple as possible. And number three, it had to be above all things safe, which is why we never use medications, and we probably will never use drugs or medications. Everything we use are nutrients and nutrient supplements or nutraceuticals, which are a cross between supplements and actual drugs. They are like supplements on steroids. Anyway, I remember this particular case. This kid with autism we're treating, and one of the pills he somehow got his hands on it in the shelf, and he just took the whole bottle, about the whole month's a whole month's worth in one sitting. Just took it all in. Of course, his mother calls me in extreme panic. She thinks her son is gonna die, and I say, don't worry about it. He'll be fine. And he didn't. There was no vomiting. There was no allergic reactions, no extreme reactions. The next day he was fine, and he's been fine ever since. So yes, we had to make it that way, and so we carried those same principles into our treatment of adults with strokes, Parkinson's, and dementia. It had to accurately. If it's not working within 2 weeks, well, 2 weeks, within a week, we're changing. We're doing something different because clearly something is not working. Think about it this way: your brain, whatever is going on, your brain needs certain things. It needs the right kind of nutrients to work. And if it is given those right nutrients or right resources or tools, it will fix itself. The problem is that most times your brain just isn't being given those tools, either by your doctor or by yourself or whatever. It's not being given the environment in which it can flourish. And that's why you don't get results from it. Once you give it those tools, it will respond. Not within, not, it's not going to take 3 months, it's not going to take 1 month. usually within days you will start seeing results. And it baffles me. Sometimes I'm speaking to other healthcare professionals who maybe treat dementia, and they say they tell their patients to wait for 3 months before they get results. 3 months. 3 months. I can't even relate to that. That makes no sense to me. And I'm not saying I bat 100% all the time, but we usually should see results. And if we don't see results, I mean there's something wrong with our diagnosis, our analysis of the situation, and we need to get back to the drawing board and figure out what exactly is going on, because clearly we are not hitting the mark. If we were hitting the mark, if we knew what was going on, and if we gave the brain what it needed in that particular situation, then we would get results. And that's the whole point here.